All right, so this is a recent paper that we've just had published, which it's really exciting. That's my first paper ever, and again, never thought I'd ever get there. It was a long, hard process, but fun. So inclusion of IUD insertion to registered nurses' scope of practice. So this started off as a research project for our organisation, and I am actually quite a latecomer. I was one of the nurses trained. One of our other amazing nurses started off this process, Fiona Kemeny. She no longer works for our organisation, but she's still a really big advocate for nurses in reproductive and sexual health. We look at, again, IUDs are really highly effective at preventing pregnancy. They're about 99% effective. They're as effective as sterilisation or permanent methods. The uptake is low in Australia, and with IUDs alone, it's about 6% uptake of Australian contraceptive users. Registered nurses are ideally placed to increase access to IUDs. You know, we're that trusted person. We have that time to talk to clients. You know, you can see that they've got kids hanging off of them, and they just don't want any more pregnancies, or they just can't think about taking a pill every day. And IUDs are a really good method, and a lot of women just have no idea that they even exist. So, to try and get more access and make them more available, in 2012, Family Planning introduced an IUD insertion training programme for nurses. That training involved a theoretical learning, some simulated practice, and some supported clinical practice. So what they did, first of all, they trained Fiona through initially, just to see that we were capable. Fiona did amazingly and was a really amazing advocate. We decided to then, as we were training through other nurses, we wanted to do a study that looked at the attitudes and expectations of both the nurses and medical officers before and after the training that we did. And that's what we managed to get published. So how did we do it? We did some semi-structured interviews, and we conducted them with RNs before the training and with MOs after the training. So we invited every nurse that we had working in the organisation through email to participate in the study. There was about 10 of them that put their hand up that they were interested and wanted to take part. So they were interviewed before the training, and that was all recorded and has been gone through in vivo for analysis and thematic analysis and stuff later on. 4 eventually out of that had put their hand up and said they would like to be included in the IUD insertion training. And quite luckily, they ended up being 1 from each of our fixed sites that were trained. So we had 1 nurse trained in Double, 1 in Hunter, 1 in Ashfield, 1 in Fairfield, and myself in Penrith. With the MOs, we did RN and MO completed interviews and surveys after the insertion. So the RNs were interviewed via phone, and the 6 medical officers who had been that mentorship, had done that practical training with us, they were asked to give feedback on what they thought of nurses in comparison to doctor trainees, but also what they thought about nurses expanding their scope. So thematic analysis was used to identify key themes and patterns, and we obtained ethics approval from Family Planning New South Wales Ethics Committee. So the registered nurses, most of them thought that this was an opportunity to increase their skills, their critical thinking, their procedural skills, and it was a bit, a lot of them felt that it was a real push for trust in the organisation. Our management were trusting us to do this really new and amazing big step in our skills. So nurses said it just made them feel more comprehensive, meant that they could take that next step. You counsel people and you've spent years counselling people and then handed them off to the doctor. So now we can actually do that. We counsel them, we bring them back, we do their insertion. A lot of them felt that it was a real thought process of widening that critical thinking, thinking about, how do the potential implications or procedural complications, how do they actually work when I'm the one that's taking that risk. There was some concerns, and procedural complications and that fear of something going wrong was a big thing for nurses. They were worried about how it might affect their clients and their clients' trust in them as a nurse, but they were also worried again about how it might affect the registration and whether nurses would be judged more harshly than doctors might be if something did go wrong. We found in a study that we did about the outcomes of nurse-led IUD insertion that nurses are no more likely to perforate. They're no more likely to have any procedural complications than what doctors are, who are, again, at the same stage of training. What I thought was really nice was most of the nurses were actually concerned about the effects upon clients. You know, there was that kind of background, oh, what might it do to me? But most people were more worried about clients. And it was unfounded by the end of the research. Another concern, we talked about it earlier, was that the nurse inserters might be less favourable to clients, or that the clients might say, oh no, I don't want a nurse to do that. That was absolutely unfounded. Not a single client had complained during the training or has complained since 2012 about a nurse doing their insertion. Most clients just don't even care whether it's the nurse or the doctor that's doing them. We did initially, at the beginning of the study, exclude nurses from doing insertions in nulliparous women, so women that haven't had any children, just because the cervix can be a little bit tighter and it can be a bit more complex, but we don't actually have that. We don't have that anymore. We've managed to move beyond that in our skills and our scope. So what did the doctors think? The MOs, they were really positive, and it was such a nice thing to read through the interview scripts and to just hear how positive they were and how supportive they were over our nurses expanding their scope. You know, they acknowledged that in a lot of ways our nurses have more skills in counselling on contraceptives than GPs coming through in training, because we've been doing this and talking about this for years. And they also were very supportive in helping us to gain those skills. We did ask the nurses who were chosen to go forward to choose an MO who could be their mentoring support person. So those relationships really blossomed during the training. But also, I have to say, with my mentor, we still catch up nearly every week, you know, and that relationship has gone from being a student-teacher relationship to being a kind of peer relationship, which has been really nice. So they said that they felt they had much confidence in the nurses taking part in IUD insertion, and that they were very supportive of them being skilled in IUD insertion. They did identify as well that worry about complications and medical legal risks to RN inserters. Now, we had actually already talked to our insurers. You know, we didn't know at this time that nurses were going to have the same complication rates, but you know, the insurers were willing to take that risk. And we know now that they are not likely to have any more procedural complications than MO inserters. Your most common procedural complication, or your most serious procedural complication, is a perforated uterus, and that happens at about 1 to 2 per 1,000 insertions, so not very common. So, conclusions. RNs are ideally placed to provide IUD insertion services when they're appropriately trained and supported to do so. Training of RNs in IUD insertions may increase the availability and access of services for women, and the addition of IUD insertion to RN scope of practice can offer heaps of opportunities to improve clinical skills, critical thinking, procedural skills, and just increase job satisfaction from just being trusted. So lots of references. The one at the bottom, Kemeny and DeGusto, that was the original research that was published about the procedural complication rates. And it's a really interesting read. Any questions on that one?